Hi guys, so for our sports injury presentation today, I decided to do the topic on sprains. Okay, so let's introduce sprains. So a sprain is an injury to a ligament caused by tearing or stretching. Sprains are classified as grade 1, grade 2, and grade 3. Grade 1 sprains are mild, grade 2 sprains are moderate, and grade 3 sprains are normally severe. And then for significance, common in sports, sprains can significantly impact mobility and performance as well. Let's discuss muscles and bones impacted. So commonly affected areas when it comes to sprains, we have knee sprain, a thumb sprain, ankle sprain, and a wrist sprain. So when talking about the bones, the femur, which is the thigh bone, the tibia, which is the shin bone, and the patella, which is the kneecap bone, are the main areas that are involved. When it comes to the muscles, the quadriceps and the hamstring muscles can be affected. When we talk about the thumb, the bones that are involved are the metacarpal bone of the thumb and the proximal phalanx are involved. When it comes to the muscles, the abductor pollicis brevis and the opponus pollicis muscles may be impacted due to their role in the thumb movement and stability. When we look at the ankle sprains for bones, the primary bones involved are the fibula and the tibia, which make the lower leg, and then the talus and the calcaneus in the foot. For muscle in the ankle sprains, while sprains primarily involve ligaments, the surrounding muscles like the gastrocnemius and the soleus, which are the calf muscles, can be affected due to compensatory movements or strain. For wrist sprains, for the bones, the major bones include the radius and the ulna in the forearm, along with the carpal bones of the wrist. And then for the muscles that may be impacted include the flexor and the extensor muscles of the forearm, which control wrist movement. So let's discuss symptoms of sprains. So the symptoms can be pain, swelling, bruising, limited mobility, and instability. So for pain, this varies in the depending on the severity of the sprain. And then for swelling, due to the inflammation and fluid accumulation. And then for bruising, may appear around the injured area. Then we have limited mobility, which is difficulty moving the joint. And then instability is feeling of the joint being loose or unstable. Okay, so let's look at treatment for sprains. So for some treatment, we have first aid, medical care, physical therapy, and surgery. So for first aid, there's this RICE method, which is rest, ice, compression, and elevation, which is also that picture to the right. It shows the RICE method for injuries. Then we have medical care, which involve pain relievers, anti-inflammatory medications. Then we have physical therapy, which can look like exercises to restore strength and flexibility. Then finally, we have surgery, which in severe cases, this is to repair torn ligaments. Okay, so for prevention and management, we have exercises, protective gear, and lifestyle changes. So for exercises, strengthening and flexibility exercises for the affected area are important. Then we have protective gear, which are like braces or supports during activities. And then finally, we have lifestyle changes, which are like proper warm up and cool down routines, maintaining a healthy weight and wearing appropriate footwear. So here are some resources I used to gather my information on sprains. And thank you guys so much for watching and listening on my presentation on sprains.